As we talked about a couple of minutes ago with John, Boulder County is seeing a rise in COVID-19 cases, and that increase seems to reflect a new trend in the state. To break down what we are seeing, our 9 health expert, Dr. Payal Kohli, joins us now. Thank you for being here. So what are we seeing in new cases, and what do you think is causing this new trend?
So, Gary, we have seen a dramatic increase in new cases here in Colorado. Our 7-day average is now 492 cases, which is up by 12 cases per day compared to our 7-day average just last week. But really what bothers me about this graph, Gary, if you look at it, is not so much the number of cases, but it's really the shape of that slope with the sharp increase occurring in the last couple of weeks. And if you look back, we really haven't had that sharp an increase since back in April when we didn't know much about how the virus was spreading. And it's really quite simple if you ask me what's causing this increased trend. And look at the timing. We're just about exactly 2 weeks out from Labor Day. So this is a direct result of those Labor Day parties, those social gatherings. And really what's happening in the community is exactly what's happening on college campuses. People are getting together, and that's causing an increase in cases. But I do want to send a message out to our community. This is the first day of fall. We're heading into cooler weather. And as the weather cools down, the virus is going to survive longer and it's going to spread more. So we should not be going up heading into fall. We should be coming down because we know that those cases are going to go up just because of the weather.
Yeah, so since the cases are going up, are we seeing more people in the hospital too?
You know, that's an interesting question, and we talked about this a few weeks ago about how the hospitalizations metric is now less sensitive because the cases have shifted into the younger people. And therefore, as you can see, the hospital graph is relatively flat. The cases are 143, which is up by 2 from last week's 7-day moving average. But really, they're not going up in parallel to the number of cases.
So what does this mean for the positivity rate? I mean, we always talk about the positivity rate. We want it under 5%. It's a little over 3% right now. So we're doing okay, right?
Well, yes and no. So yes, we're doing okay in the sense that we're below that panic threshold. So remember, 5% is a panic threshold. We want to stay well below that. But we're not doing okay in the sense that it's gone up from last week where it was in the 2s. And again, at this stage in the virus, we should not be going up on our positivity rate. We should be going down because we have the recipe to make that positivity rate go down. We know we need more testing. We know we need to keep those cases at bay. So as we, again, head into the colder weather, I just want people to be aware that the trajectory of the positivity rate is going in the wrong direction. We really need to double down our efforts to make sure we keep that virus at bay in the winter.
Absolutely. Keep wearing those masks, keep washing hands and social distancing. Okay, thank you very much, Dr. Kohli. Appreciate it.